Hello everyone, today we are discussing about the osteology of the humerus, the bone of the arm. As it is the part of the long bone, it has two ends, proximal end and the distal end, and it consists of the one shaft. Now let's first talk about the proximal end. Proximal end consists of the head and the anatomical neck, which surrounds only the head. Then there is the greater tubercle, which is present laterally. Then there is lesser tubercle, and in between them there is a groove called the bicipital groove or the intertubercular sulcus. Then there is a surgical neck. It is the site for the common fracture. Now let's moving towards the shaft. It consists of the three surfaces and the three borders. Talking first about the borders, it consists of the anterior border, the medial border, and the lateral border. And if I talk about the surfaces, it consists of the anterior-medial surface, anterolateral surface, and the posterior surface. And there are some other things also present on the shaft. First is the deltoid tuberosity, and the second is the radial groove, which is the groove for the radial nerve. And moving towards the last part, which is known as the distal end, it has some parts called, the first one is the capitulum, the another one is the trochlea. In front of trochlea, we have a fossa called the coronoid fossa. Apart from it, laterally, if we move laterally, in front of the capitulum, we have the fossa called the radial fossa. Then this part is known as the medial supracondylar ridge. This part is known as the lateral supracondylar ridge. Here is the epicondyles, which are medially and laterally. And on the posterior side, we have the big fossa known as the olecranon fossa. And if I talk about how we got to know that which side of bone it is with the help of the head and the olecranon fossa. Head of the humerus is hemispherical in structure. It is located upwards, medial, and slightly backwards. On the lower end of the humerus, we have olecranon fossa, a big fossa, which tells us about the which side of bone it is.